Hi, I'm Elizabeth Hess. I'm here with the administrator of the Champaign-Public Health District, Julie Pryde. Julie, this is our 26th time recording these.
Oh.
They're very helpful to the community from what I hear, and people value what you say. We will continue to do these until there's a vaccine or until there's a cure. If you're with me, I'm in too.
I'm with you.
Okay, good, and
Thanks for
welcome.
having me.
Well, thanks for being here. I want to know, students are back, so we are going to see a difference in numbers next time we talk, but where are we as of today?
Well, as of today, and mind you, all the students are back now and they're starting classes today. So right now we're at 1,975 total cases, 236 active cases, 3 hospitalizations, and we're still at 20 deaths. Almost 1,000 of our cases total have been with people between the ages of 11 and 30. So those are mostly young people, college-age kids, and you know, we're seeing lots of students coming back to town positive already. So the good thing is the way it's set up, as soon as they come back, they're tested at the U of I, then they're put into isolation, and anyone associated with them is put into quarantine. So it's really helpful. We're going to see a bump in numbers, of course. This is not community transmission. They're coming in with this. We're getting them captured, if you will, and put into isolation, and then we keep track of them until they're out. And then they'll be testing 2 times a week their entire time here at the U of I.
And you keep mentioning isolation, and we keep talking about quarantine. Who is isolation for and what is it? And who is quarantine for and what is it?
Yes, and this is important because, first of all, isolation and quarantine are not suggestions. They are mandates. So if public health tells you that you are in isolation, that means that you have the illness, in this case, COVID-19. So you have the illness, you are infectious, and you must remain in your dorm, apartment, wherever you are, or in a place where we put you, which is sometimes a hotel. You have got to remain there without having interaction with other people throughout your entire time. The only time you can leave is if you need emergency medical care. That means you don't go out to get your mail. That means you don't go out to do laundry. You don't do anything. If you don't have it in your apartment, you don't do it, or your living quarters. So this is very important. It is a mandate. So again, isolation is for people who are ill. That's what we call it. Quarantine is for people who are exposed. People who are in quarantine, again, this is not a suggestion. This is a mandate. You have got to stay in quarantine for your 14 days. You should not be going out and getting tested. You should not be leaving at all for anything, nor should anyone be coming into your place. Now, this is crucial because if people are starting to leave isolation and quarantine, then we have to step it up a level. We do not want to have to do that. But, you know, we have had to put people in the past in ankle bracelets. We had to get the courts involved and make sure that they're staying in there. Obviously, we do not want to have to do anything like that. People need to understand the importance of this and remain in isolation or quarantine until public health releases them. We have contact with them every day. They can reach us all the time when they're in isolation or quarantine. And if they're a student, they can also reach someone at the U of I the whole time they're in isolation or quarantine. So it's the biggest thing that we can do outside of, you know, masking and social distancing is to get people isolated in quarantine so that we stop the spread from just continuing and continuing.
Again, it's not a suggestion, it's a mandate, which means
it is absolutely a mandate. And just because you're not, you know, we're not showing up and pinning a quarantine sign on your door, we can, or an isolation sign, we certainly can do that. We do not want to have to do that. We want people to take this seriously and do what they need to do, because otherwise they risk spreading it. Do not leave at all. Do not get in the car with anyone. Do not go anywhere. Do not have anyone into your living quarters. Do not be around anyone. That's how this works.
You mentioned that U of I students and faculty are getting tested twice a week. Who came up with that 2 times a week, and how does that number mitigate the spread of this virus?
Well, it's so a lot of that came from predictive modeling. The U of I obviously has some amazing modelers, and the modelers that the state of Illinois have been using have been, right on target. And so they were able to take all of this information and put in different scenarios, and they came up with the 2 times a week. If you note, and what's really important is that people, as soon as they come in, are getting tested immediately, and then the mitigation follows. What you've seen with a lot of other college campuses is that people just came back and then they just started spreading it around. You can't do that, because we knew, as other colleges and universities should have known, the spread is increasing in this age group because they're out running around. They're certainly out running around before they come back to college. So everybody should have known that that was going to happen, and put measures in place to not let them, cause other outbreaks, community outbreaks, or things like that. So that is, crucial. Did I even get your question answered? I don't know.
You did, the 2 times a week. Yes, you did.
Yeah. Oh, so the modelers came up with that, and that could be adjusted if needed, but it makes perfect sense, and that way they're going to catch everything early before there's a chance to get out and really cause a lot of spread. The other things that have been put in place, as you probably saw, are measures about bar seating, making sure that people are outside and that they're seated and that they're not up running around. The masking is crucial to continue, masking and social distancing. That just has to continue.
One of the things that the Board of Health put together is the face covering and gathering restrictions ordinance went into effect. It's in place until, according to your website, your agency decides it's in place until. Now, remind us exactly what that entails.
Well, this is actually put now into the communicable disease code. The only difference is that we locally have the ability to do an individual fine if need be. But the deal with that is that came from the state, and that came from health department saying, hey, we can't deal with this because people are not, our county is doing a pretty good job. I'm just going to say that right now. I say it all the time. But a lot of these counties, they'll have outbreaks and they'll have all these problems, and then their local sheriff's office won't help them. The police won't help them. The county clerk won't, or not the county clerk, but the state's attorney won't help them. So they're really having a lot of problems. We've had a lot of cooperation in our county, a lot of people doing modeling to show, this is us wearing the mask, and this is like what's expected. So I think our county was less of a problem than others, but that's now in the communicable disease code. So we have that ability to do that with other infectious diseases, whether they're a pandemic, respiratory, or an endemic. So it just kind of adds to our mitigation strategies like we have with isolation, quarantine, closure, and now this. So, it's a joint effort. It's going to be the city of Champaign, the city of Urbana, the U of I Police Department. It's going to be public health. There's going to be a whole bunch, U of I. There's going to be a whole bunch of people out there trying to keep us safe while we get through this. So what we really need is for people to continue what they're doing, especially in our community. I was out this weekend. I had some little chores to do, so I had to go out to one of the big stores, and I didn't see one person without a mask. And this was a store that normally would have not have a lot of masks. So I was really happy to see that. People seem to be, really taking it seriously, and that's very encouraging.
That is encouraging. So I read that 1% to 2% of the national testing is happening right here on the U of I campus. Have you heard that?
Yep.
And are you satisfied with where we are at the current level of testing?
I am. It is beyond my wildest expectations. I'm just going to tell you. Testing has been nothing short of a national nightmare and a disgrace. It's just, I don't even know. It's just ridiculous. I don't know how we got to where we are and why it isn't fixed yet. But U of I and Carl worked early on to get their labs expanded. So we've had adequate testing here for a really long time. Plus we have the site at the mall. and we use the Carl Lab for that and all the other sites. And then the U of I they just took it up a whole new notch. They just developed their own their own test that is fast and really available. I mean, they can do 10,000 tests a day, normal tests, and 30,000 tests a day if they do pooled samples. That's incredible, and that should be happening all across the country. And if we had that, we would be in a whole different situation. But it's not just, you can't test your way out of it, but the testing is a very important tool. So yeah, I mean, that's going to be the difference. If there is any place in the United States that can go back to school, it's going to be the University of Illinois right here in Urbana-Champaign. If this does not work, then nothing is going to work, because they literally have every single thing in place that makes this so it should be successful. So we're all just kind of following along and seeing what's happening. But the thing of testing everyone when they first came in, that was critical. And having access to the test all the time. And yes, it's a pain and people will get sick of it, but it is for a short period of time in the grand scheme of things, and it is very, very necessary. So if the students want to continue going to college and not living back at home, if that's where they came from, they really need to do their part with the masking and the not gathering and things like that. And so I think the vast majority of them will do that.
Okay, so let's say, I'm going to play devil's advocate here. Let's say that they're not doing that, and then we get 3 cases in a dorm, and then 10, and then 20. What happens then?
Well, I mean, we investigate every single case, and we do the mitigation factors based on that. And I've said this a million times, and I can't overstate it. You can never prevent a case from coming in anywhere, but if you're doing the mitigation or the prevention inside of the buildings or wherever, you will not have an outbreak. Now, what happens if you have kids in there and then you have an outbreak in a dorm? It will be the same as if you have an outbreak anywhere. We will have to isolate everyone, possibly even, close off an entire section. I don't know, but the idea is it's a very simple idea. It's to keep the infected people or the infectious people away from the vulnerable people, the people that can get it still. So, that's what we're working for. But it could certainly happen where we would have an outbreak in a dorm or in a frat house or a sorority or a apartment complex if they have a party or something like that. It's very possible. So we want to keep those numbers as low as we can.
You mentioned that this is until there's a vaccine for this virus. Well, the FDA issued an emergency use of authorization for the use of convalescent plasma to treat COVID. Where does this fit between vaccine and cure, and is it even viable?
Well, so I have not read enough about this as I need to, but in general, what you want to make sure that's happening is that the scientists are leading what's happening. So I don't want to see the FDA pressured to do something for any type of political reason or any type of other reason. They need to do what they need to do. They need to have the study set up so that they are sure that what they're doing is not only effective, but also safe. And you have to do that through certain kinds of studies. That's just how it works. And that's with a vaccine or anything. And if you start getting, politics involved in this, what happens is people will lose trust in it. Because the FDA and the CDC and places like that, they're just supposed to be getting out the accurate information. They're not supposed to have any undue influence on them. So it worries me a little bit that and it may be perfectly fine. I mean, I'm sure that I have definitely read that works on some people, but what you need to know by doing these studies is, who does it work on? Does it work on everyone? Does it work the same? And is it safe for everyone? And you have to do studies to know that. You have to keep doing your studies. And when you do something like an emergency use authorization for either a vaccine or a treatment, that's a little different than a test. because there are sick people on the other end of the treatment or the vaccine. So I hope it's a good thing. Things are moving every day. There's new stuff coming out every single day, but you definitely don't want to see politics get balled up in that.
Yesterday, I'm glad you brought up politics. I was watching Fox News and one of Trump's aides was on meeting with lawmakers. They said a vaccine would be approved before the election. That's amazing. Is that true?
Well, I've never heard of that, but I have not heard of that. But I hope that's not what I'm talking about here, about things being pushed ahead before it's ready. Because they're already working on vaccines everywhere at a remarkable speed. I mean, there has been so much money put in this by all kinds of places, really trying to get a vaccine out there. But again, you have to have the safety and efficacy trials first. We don't want to run into what we did in 1976 with the quote unquote swine flu. You may recall from reading, because you're probably not old enough, but you may recall from that there were more people made sick by that vaccine than actually got sick from the disease. So you can't really push things out too fast. They have to go through all the right channels to do this. They can speed all that up, which they are doing, but they still have to do it. So
you just fed me my segue that people complain that the flu shot, quote, makes them sick. This year, it is more imperative than ever to get a flu shot. Unless you have, of course, a latex allergy or an egg allergy, there are certain people that are exempt from getting it. But who else should get it this year?
Okay, first of all, let's just go right back to that. You do not get sick from the flu vaccine. People always say the flu vaccine, not everybody says that, but they'll say the flu shot gave me the flu. Do they believe that? Yes. And maybe have they gotten the flu shot and then gotten the flu? Yes. But that was not the killed virus in the flu vaccine. What that is waiting too long to get your flu vaccine, and then your flu's already circulating in our community, and you're either already exposed or you're exposed after you got the flu shot, where you're still waiting the 2 weeks for immunity to build up. So what I would really, really like to see in this community is, well, more than this community, everywhere, is that anyone 6 months and older get your flu vaccine this year. Unless you have a absolute, known allergy to something that's going to cause you a lot of problems, get the vaccine. 6 months and up, it is crucial. Start getting them in February, start getting them in September. So, we're like, a couple weeks away. From September and October, everybody hopefully will have their flu shots done by then. But if you didn't for some reason, you can get them all the way through spring. So, but it's really important to get it early, meaning September or October, and make sure that you are not going to get flu and spread flu and overrun the healthcare system. Because last year alone, our hospitals were really overwhelmed with flu. Now, if we get flu and COVID and all the other stuff that goes around in winter, we could overrun the healthcare system. So even though we have two, large hospitals that are doing a great job, and both of them are able to expand beyond their current capacity as well, we do not want to do that. You only have so many healthcare providers. So it's not just about, physical location or something like that. It's our whole healthcare system. So please, if you are at all able to get a flu vaccine and you are 6 months or older, go get that flu vaccine.
Are you worried about cold weather coming with the flu and people then going inside to eat and congregate, and the warm weather and the humidity and the light isn't going to be able to kill the virus as readily? Does that worry you?
Well, I definitely am more concerned about winter when people are inside a lot more. However, what we're telling people to do now, that's not going to change. So you still need to, if you're inside, you're going to need to have masks on if you're around other people. You're still going to need to be 6 foot apart from people. I will change my behavior from going to work to my porch to from work to the inside of my house. So, I will be pretty much doing the same thing. I will pick up food, and as long as I can eat outside somewhere, I'll do that. But, as far as being inside in small places with people without masks on, I won't be doing that.
Last question before I let you go. I see that you are very reactive on social media, of course, emails, and you're very accessible. And people have asked, well, who does Julie report to? Is she an elected official? How does Julie Pryde, who does she report to in terms of a board? How do you get into your position and who do you report to?
Well, I was hired, I've worked here since 1995, but I was hired as the administrator by our board, Champaign-Public Health District Board, in 2008. I was appointed as acting in 2007, but was hired in 2008. My board consists of the Champaign-Public Health District Board, which is an elected board, which is the chair of the Champaign County Board, and the supervisors of Cunningham Township, which is basically Urbana, and the city of Champaign Township. So that is those are my bosses, and that is who I report to.
Well, thank you for being so reactive and so responsive and so readily available. I appreciate that. Thank you to Jason Liggett, our wonderful producer, week after week, never complains about a thing. I want to thank Urbana Mayor Diane Marlin. She is a fantastic partner in all of the dissemination of information. And Julie Pryde, thank you. You're the administrator of the Champaign-Urbana Public Health District, and we're all grateful for you. Thank you so much.